Patients come into the office usually after having children, but it could be after losing weight. And they explain that they're not happy with the way their breasts look, that they're sagging, and they need some more volume, and they would just like to have a little implant to replace that volume. So this is a very interesting discussion to have with the patient, because sometimes these people actually need a breast lift, which we call a mastopexy, also. It's important for people to understand, like, why would that be the case? So when I examine the patient, I'm looking at how much extra skin she has, and then very importantly, in relation to the crease, the fold underneath the breast, how much tissue, breast tissue and/or skin is below the fold, and where is the position of the nipple on the breast. Because two things can happen if we're putting only in an implant, but they really need a lift. You can have the position of the nipple be too low on the breast, and so it doesn't look in proportion. It's not in the right position. And then you can have what we call a waterfall effect, where the breast tissue is waterfalling off the edge of the implant. And then the question always becomes, well, what about the scars? So sometimes you can do an incision around the areola, which we call periareolar, and it's usually not that noticeable because the scar itself, the incision, is right at the perimeter of the areola. It's a circle, the areola is a circle, so when the eye looks at the breast, it doesn't really see it that much. If they have more skin that needs to be removed, then we have to do what we call a lollipop, where you have periareolar and vertical. We show a patient a picture of the vertical scar and it scares them, because if you see an early post-op picture, that incision is more noticeable. Over a 1 to 2 year period, that incision will fade to a white line and it really will not be perceptible. Then another scenario which occurs is the patient comes in and says, my breasts are kind of deflated and sagging. I don't like the way they look, but I'm not sure if I need an implant or not. So one of the key questions that needs to be asked in a bra, how do you feel about your size? So by being in a bra, it takes away the shape issue. It converts it to a volume issue. So if you're in a bra and you're happy with your size, most likely we can just do a mastopexy or a breast lift to get a better shape and get the lift. If in the bra there's not enough volume to give you some fullness in the top, or you're just unhappy with your size, then we're going to need a small implant to do in conjunction with the breast lift. So mastopexy is a great operation. It's really simple. The incisions are going to heal. You have to give it time, and whether or not you need an implant really depends on how you feel about the volume in a bra.